This is your 420 Radio News for Thursday, May 23rd, 2013. I'm Russ Belville. New Hampshire Senate passes bill legalizing medical marijuana from San Francisco Gate. New Hampshire soon could join 18 other states and the District of Columbia in allowing seriously ill people to use marijuana in their medical treatment. The state Senate voted 18-6 Thursday to pass a bill legalizing marijuana use and possession by patients with conditions such as Crohn's disease and cancer. The bill now goes back to the House, which is expected to ask to negotiate a compromise. Governor Maggie Hassan, who supported both options when she was in the Senate, now says she won't sign a medical marijuana bill with a home grow provision, citing concerns about the state's ability to regulate such operations. The Senate passed a rewritten version of the medical marijuana proposal, striking the home grow option and making other changes requested by the governor. Among the changes were removing post-traumatic stress disorder from the list of approved conditions and decreasing the number of dispensaries statewide from 5 to 4. To qualify for medical marijuana, a person would have to have been a patient of the prescribing doctor for at least 90 days, must have tried other remedies, and must have exhibited certain symptoms. Only New Hampshire residents would qualify. Patients could possess up to 2 ounces of marijuana. Committee sends bill for medical marijuana clinics to Nevada Senate from the Las Vegas Sun. A plan to create a network of medical marijuana clinics with the owners paying hefty licensing fees was approved by the Nevada Senate Finance Committee today. The bill, SB 374, would limit the number of dispensaries to 1 for every 10 pharmacies in a county, but it sets a maximum of 40 dispensaries in Clark County, 10 in Washoe County, 2 in Carson City, and 1 each in the remaining counties. A person who applies for a state license to operate a marijuana clinic must have $150,000 in liquid assets and pay $20,000 for an initial license and $5,000 for an annual renewal. The bill would require an upfront $5,000 fee to cover processing and background checks by the state health division. Dispensaries could not be located within 1,000 feet of a public school. Texas lawmakers passed drug testing bill for unemployment insurance, kill similar legislation for welfare. From the Huffington Post. Texas came a step closer to requiring some applicants for unemployment benefits to first undergo drug testing when lawmakers gave final approval to a Republican-backed bill mandating such checks on Wednesday. The measure, which passed the state House 104-42, had already passed the state Senate. Texas Governor Rick Perry had earlier urged legislators to require drug tests for those seeking unemployment or welfare benefits in the state. A separate bill mandating drug testing for certain welfare applicants passed in the Senate, but failed in the House on Tuesday after chamber Democrats managed to block it from coming to a vote before the midnight deadline. Bill would help Scotch Plains toddler other sick kids get medical marijuana from NewJersey.com. Moved by the plight of a toddler with seizure disorder, 2 Union County lawmakers announced today they have drafted legislation that would revise the state's medical marijuana law to make it easier for children who qualify for the program to benefit. Vivian Wilson has Dravet syndrome, a rare and severe form of epilepsy that conventional medicine cannot control. But before her parents, Megan and Brian Wilson, may buy marijuana for her, state law says they need the approval of a psychiatrist, a pediatrician, and the doctor treating the child's illness if the pediatrician is not in charge. The bill would require pediatric patients to have to obtain only the treating physician's approval, the same requirement as for adult patients. Medical marijuana, braids, and cornrows, Oregon Legislature today from OregonLive.com. Today, the state Senate is set to vote on a resolution to designate brewer's yeast as the state's microbe. Meanwhile, a medical marijuana bill to allow post-traumatic stress sufferers to use medical marijuana is set for a House floor vote. Senate Bill 281 is near the end of a long to-do list in the House and could get postponed to another day. Should jury hear of Trayvon Martin's marijuana use? From HeadlineNews.com. George Zimmerman's attorneys want jurors to hear evidence about how Trayvon Martin may have been high on marijuana the night he was shot to death. Martin's toxicology report indicates that THC, the active drug in marijuana, was in his blood at the time of his death on February 26, 2012. In court documents filed Tuesday, Zimmerman's attorneys argue the report shows Martin's judgment may have been impaired the night of the shooting and may have affected his decision-making. Zimmerman's drug use has also come up in the case. Martin family attorney says Zimmerman should have been tested for drugs the night of his shooting. A fire and EMS report says Zimmerman was on the medications Librax and Temazepam at the time of the incident. This is your 420 Radio News for Thursday, May 23rd, 2013. I'm Russ Belville. When we come back, we're going to go behind the headlines and take a look at a tweet from Kevin Sabet, who claims 39% of all high school kids in the state of Washington get their marijuana from marijuana dispensaries. We'll show you the simple math error that made such an egregious mistake on his part. You're listening to The Russ Belville Show on 420radio.org. We'll be right back.